Good morning, Mr. Chairman and all the members of the committee. I appreciate and thank all of you for allowing me to come and speak this morning. My name is Mike Schroyer, and I serve as president of Baptist Health Floyd in New Albany, Indiana. And I'm here today on behalf of the Indiana Hospital Association to testify in support of Bill 1271. I also want to thank Representative McGuire and Senator Brown for all of your hard work on this bill. This bill creates a brand new standard that is not otherwise found in federal or Indiana law. It will require us to give clear information and consistent transparency about payment plans for our patients. IHA is not aware of anybody, no hospital here in the state that does not have a payment plan available for our patients. We have figured out, though, that we need to do a better job of making sure that people do know that we have the plans, what they are, and how to access them. So we really appreciate what you have done to work in the amendment to allow us the flexibility of when we give that information. There's various different times that we can give it as outlined in the amendment, and we do appreciate that. Okay. We're also very supportive of the downcoding and recruitment language included in the bill. We're supportive of moving the 2-year down to a 1 year to limit this practice. We would caution about extending that any further than 1 year. If you do decide to decrease that time, we would be in favor of that as well. Limiting recruitments is all about ensuring that we get things approved in time, we get our payment in time, which is very important. A lot of time is spent in the hospitals today. I mean, for our system, we spend millions of dollars on people just dealing with these type of situations with recruitment, clawbacks, and denials, the whole bit. At my system last year in 2025, we had over $12 million in recoupments and saw downcoding practices spanning sepsis cases to newborn cases to emergency department visits, even when our medically necessary services were in line with CMS and industry guidelines, instead of payers' own guidelines dictated which claims were subject to downcoding. It is particularly disheartening when payers downcode claims for infants with congenital heart failure, stating the congenital heart failure was not further evaluated when we know and we have documented that they did receive testing during their stay in order to further diagnose and determine the severity of the congenital disease. When hospitals like mine who are operating on a negative margin right now, even with high volumes, our volumes are higher than we've ever seen right now. We have more and more people coming to us. We really depend on what we do get. And, with the uncertainty of recoupments and clawbacks and that, it just makes it harder to try to run a hospital. So again, we are very much in favor of this bill. I do have some examples, if you'd like to hear of them, of some of the recoupments that we have experienced. And again, thank you, and I'd be open to any questions.
Thank you for Senator Johnson.
So I'm just hitting on this 180-day provision. It is really interesting because we've heard from a lot of different people that it's not doable. I mean, I do this, so I think it's very doable. What would keep you from meeting 180 days on your end versus, I mean, it seems very reasonable for 6-month time frame to meet the billing practice standards now.
Yeah, no, I think, we're in favor of the year, making it a year. For hospitals, it is a lot easier because we have a lot more resources. We have a lot more revenue coming in than the smaller groups, individual groups do. And I think that's why you're hearing 180 days for some.
Yeah, so you would want it a year, but you would be okay with 180 days? Is that what I'm hearing? Or, okay.
Yeah.
All right, good.
Thank you.
Thank you.